So I was having a little look around to find this, and it's the book that I took with me to my visits. And I just jotted down a couple of things. And it was actually quite nice because I've just found it today. I was having a rummage, and it was nice to have a little flick through of actually. It brought back quite a lot of memories of the family. Yeah, it's lovely to read through it again. It was incredible that they would let us into their home and talk about something that might be quite difficult to talk about with strangers that they've only just met. And it was a great experience. I enjoyed it a lot.
The family that I got to see were a husband and wife, and the husband was the person with dementia. He had a mixed Alzheimer's and vascular dementia, and the wife was the main carer. And we were actually really lucky because we got to see the family within 3 or 4 weeks of the diagnosis. So over the 3 years, we got to follow them on their journey from like the start to when we finally said goodbye to them. And I think that was really interesting because we got to see how rampant or how everyone responded to the diagnosis, especially the carer. Because we asked her, what would you like us to say to people about dementia? And she said that the care is with them all the time, and we do struggle. And that still stays with me today, I think. Because even when I see patients that don't have dementia, I'll try and like, oh, hang on, how's this going to influence like the patient's family, not just the patient?
The lady I was with at the family, she quite liked poetry, and she wrote a poem about kind of her experience of, I guess, becoming a carer, if you want to use that word. And I wrote the first line of it because it stuck with me. Today I lost a part of you that was here yesterday. And that was the first visit. I forgot that was at the first visit, and I think that kind of shows you how they let us in. And that poem obviously was very personal. So I forgot that was at the first visit, actually.
So when I first got the details about the family I was due to visit, my first impression was surprise at how much experience they had both personally and professionally with dementia. So one had previously acted as a care worker for dementia before retiring, and the other individual had also previously cared for someone with dementia. So they had a really significant amount of experience, which can be quite intimidating, I suppose, when you feel that you've got so little at the time. I didn't know much about dementia when I started, but I absolutely did by the time it had finished, because my family, not only did we have great conversations, but they gave me a file of patient information leaflets, information about the condition, advocacy groups, everything, and just handed me this file and let me borrow it for several months. So it sort of worked quite nicely to link that sort of personal element of dementia with the healthcare area of dementia, and how those two can overlap and how you can sort of help each other in that situation.
It definitely changed, altered my perception actually of Alzheimer's and dementia, in that actually, although it's quite a scary term for some people, I got to see a lovely couple that lived a very normal life at their age. You know, they had lots of support. You know, you could tell that although it was a difficult time for them, they still lived life and they still enjoyed their company together.
I'd seen people in acute hospital settings where you just see that person there and at that time and space when they're unwell. But going into the dementia family, I really learned such a lot, that actually this lady had a huge history that I knew nothing about. And I was learning about that as I went, and I think it's been really valuable to me to know that, yes, when I go on to my career in a hospital, that when I'm caring for someone with dementia, that I've got to remember that that person's got this big life behind them, probably a really interesting one, and it's worth getting to know.
I'm a practical person, so actually this was a practical exercise, and I believe that helped me more than having to sit with a textbook. So for me, getting out there was beneficial to me rather than having to try and learn about it in a book. It's very difficult to teach this kind of complexity.
I think you learn a different level of respect for people. It sounds very strange, but because you are so involved and you appreciate more and more the position they're coming from, I think you start to really admire them and really admire what they're up against on a daily basis, and those challenges they have to encounter day in and day out. So I think it does change the way you view patients as a whole, because I think it's quite easy to forget just what's going on outside of the hospital, but actually how important that is on someone's health, and in fact the health of a whole family.
I always remember leaving visits feeling just happier. It was just a nice environment. And again, it was, even though I suppose the reason of this is a learning opportunity as well, but it was also kind of good for the soul in a way. I will always remember them. I will always remember our family that we visited, because they were great human beings. They were lovely. Yeah.